have regimes that you recommend, or?
By the time we get them, the toll of not doing things right is already there. And by that time, they have arthritis, because anybody more than 50 years old, 80% have osteoarthritis. They have lots of neck and shoulder pain, and their posture is very poor. They're like this. A lot of females are already, the estrogen level is so low at age menopause, paramenopause, and that's the time when they have more and more pains. So these are the ones that we love working with, because these are the problematic cases in the hospitals, which takes too much time. They do MRIs, X-rays, all the crazy tests, and these are very expensive tests. But in our clinic, we don't even look at their MRIs anymore, because once you manipulate them for low back pain, they improve dramatically.
And if you were to look at, say, a young person like Vinci,
well,
what would you see? What would you see?
The problem actually with children nowadays.
Notice I didn't ask you to look at me.
The problem with children nowadays is going to school is a big problem, because their bags are humongous. They're very big bags. And these big bags are so heavy that they cannot really carry it. That's why they have to put wheels. But what if your school room is on the 4th floor? How will the poor child bring that up? Now, females also have a big problem, because your bags are ridiculously heavy. You have washing machines, oven, toasters, whatever inside that bag. That is why every time you put the bag here, automatically your shoulder goes up like this. You become functional scoliotics. So prolonged heavy load on the shoulder makes the muscles on the upper traps go into locking state. That is why when you look at females, their right shoulder is squared, the left shoulder is slanted. If you put your bag on the left side, it's funny, so it always falls off. Have you not noticed that? So the tendency is you have to bring it back here. Even at an early age of about 12, 13 years old, that's the time when you see scoliosis among females especially.
And can you say that word again, scoliosis, and tell me what it is?
Scoliosis is when the spine, if you look at it from the front, is curved either towards the right or the left side.
I see.
They call it a dextroscoliosis if it's curved towards the right side, levoscoliosis on the left side. A lot of attractive women, they are scoliotic. That's why you keep on joking with them. Are you sure you want us to straighten your spine? I said, why? Because if we straighten your spine, you might not be beautiful anymore. But it's easy to do that, because scoliosis is primarily a muscle problem. It's not a bone problem. The bone problem is the result of a chronic muscle problem.
So you would just look at somebody, and they would come in and they would say, okay, I've got migraines, or I have neck and shoulder. Let's first ask, you said that you can cure migraines in a second or so. So what is the basis of a migraine? Where does it start?
Well, remember what we have been taught in school is intracranial blood vessels have vasospasm and vasodilation, causing all these things. The release of so many inflammatory reaction substances. But it's just simple spasm of the anterior fold of the upper traps muscle. And that's so easy to approach. That's already outside. That's why in just 1 second flat, the migraine is gone.
So you're just doing some sort of pressure on...
Yeah, but it has to be a 13.2 kilo thrust. Isn't it nice? 13.2 kilo.
13.2, right?
Yeah,
and this takes us to another point. I read on your website that you have trained 2 other doctors.
Many doctors actually now.
So you are training other doctors
Sure.
to perform these therapies. How long does it take to become skillful at what you do?
Yeah, that is a very good question, because my brand of myotherapy is not taught, it is done.
I see.
It's hands-on. And for other people, it's so easy to, if you have the skill, the inborn skill of doing manipulation, so easy to do. But for others, it takes them months to master the technique.
And it's not something you can learn in medical school. It's something you have to just do to...
They must teach this in medical school. But the problem is you will not have patients anymore in pain. It's only 15 seconds. No more blood tests, no more MRIs, no more X-rays.
You said you're focused on muscles, but how come you've been treating children with
bronchial asthma? Yeah, because we've been doing strokes, by the way. Strokes is nice with us because even if after 10 years the hand is locked like this, it takes only 1 second for that hand to drop and relax and even start moving. It's just
Really?
technique. It's just technique. So I have seen improvement in Parkinson's disease, severe osteoarthritis, even gouty arthritis. Our patient last night was gouty arthritis. And in children with bronchial asthma, it's fantastic. Just a 15-second manipulation, no more asthmatic attack.
And that comes from, I thought asthma is what an inflammation, right? It's inflammation.
There's inflammation, but it's not primarily an allergy reaction.
Oh.
Because if you scold your son, they get asthmatic attacks.
Well, yeah.
Yeah, if they are under the heat, you know, the sun, they get asthmatic attacks. If they start perspiring or running around, they have asthmatic attacks. So there are physical factors that trigger these attacks. It doesn't necessarily become a allergic reaction.
Really?
As a cause of bronchospasm.
Well, I know that asthmatics have a tendency to have an attack if they get a high tension or high
they're stressed,
anxiety or stress, and so this manipulation that you do with
it does wonders
asthmas.
because our manipulation actually releases the morphines of your body, the beta endorphins. And the half-life of this is usually 2 hours. But with the manipulation, it's strange because immediately after the manipulation, the shortness of breath improves dramatically. You see them become pink right away. We call it the Jekyll and Hyde phenomenon. Can you imagine somebody is difficult and then in stridor or the sound is all of a sudden there's no more sound and the child can now run all over the place. So there's hope. There's very good hope for a lot of listeners there whose children are suffering from bronchial asthma. They can try it.
You know, and it's not a trivial thing because one of my friends in the Air Force actually died of an asthma attack. And Teresa Tang, a singer that she was one of my favorites, died of an asthma attack. I think in the early 40s or whatever. And so it's not a trivial thing, asthma, especially childhood asthma, because it's a very scary thing for them. And
it puts parents under severe stress, by the way. It's not only the child who is having an asthmatic attack. The parents also have an attack in one way or another.
Wow.